Hello and welcome to Health Professional Radio. Thank you so much for joining us today. I'm your host, Neal Howard, and in studios with us is Mindy Bolton. She's a creativity coach and dementia care practitioner, utilizing improvisational theater techniques, visual art, literature, music, and dance to engage those with dementia and Alzheimer's, and also ignite maybe some hidden passions that could improve their quality of life. How are you doing, Mindy?
I'm good. How are you?
I'm doing well. Welcome to Health Professional Radio.
Yeah, thank you. I was thrilled to hear about it. I'm glad to be on.
Good. You're a creativity coach dealing exclusively with dementia patients, being a dementia care practitioner. I've talked with people that are implementing certain techniques when it comes to those dealing with dementia and also in helping those who care for dementia patients. I don't think that I've heard of visual arts or dance or even theater techniques when it comes to dealing with dementia care patients. Are you a pioneer in this technique?
Well, I've had a lot of help in discovering all this, and I would say that, bringing it in a package and focusing on it so intensely, I would say I am a pioneer, but I have a lot of influencers. I currently live in Minnesota, and Minnesota has great funding for creative arts in general. And so there are a lot of people in this general area who are exploring exciting ways to use art and to build community. And as we see, there's an increase in our aging population, more than ever. There's more people over 65 than there have ever been due to the baby boomers. And these people are addressing things that we haven't ever addressed. What to do with your time when you're retired and aging. Also, if you do face dementia, a lot of people are still learning about dementia, what it is, what to call it, how to talk about it. And I found that creativity in general, using these identified art forms, helps people better understand what it is and how to cope with it and how to foresee potentially a future with it, whether it's yourself or a loved one.
Which came first, dementia care practitioner Mindy Bolton or creativity coach Mindy Bolton, or did it develop hand in hand?
Yeah, they've evolved together, but my background is primarily in lots of caregiving environments. So I would say, but the caregiving environments were introduced in my life while I was studying art. So I found that working in group homes and locations that serve people who need care, the care is 24/7. So it's a great job to have while you're studying, and I happen to be studying art. And so it was a beautiful serendipitous marrying of the two that made it what it is. And I found that creativity coach is a good term to use because people feel less threatened. Sometimes if you even call yourself an art teacher, they think, oh my, I'm expected to learn something, I'm expected to perform in a creative way. Whereas creativity coach is kind of more, I understand that perhaps you don't feel creative, but this is how I can help you become more creative.
So you're taking away the, the expectation that a teacher would have, and then turning it into the expectation on the patient that a coach would have, kind of like, when you're coaching a high school football team.
Right, and a lot of the times I even say, I'm not a master of any of these areas, theater, visual art, dance. I've dabbled in all of them to where I experience people under my coaching or involved in my coaching that are perhaps or for sure better at that certain area than myself, So that also is the dynamic, is I'm sort of helping people tap into these internal skills as opposed to letting them know, here's what I have to offer you as an individual.
So you were a caregiver while you were studying art. If I may ask, were you giving care to a loved one, or was it just part of the job? Or were you doing a combination of the two?
It was somewhat of a combination. During the time that I was studying art and working in group homes and as a PCA, my Nana also had vacillating healthcare concerns that they're learning more and more that dementia can result from internal organs going haywire. Everything's connected. So in her case, she never received a proper diagnosis although she displayed dementia symptoms. So she did not have Alzheimer's, but because of her heart condition and things of that nature, she started to form concerning behaviors that led her to be in hospitals and assisted living environments. So I was having a long distance relationship with her during this time, and so I learned a lot about sort of the initial complications that can happen within care. And my Nana particularly was a very creative person, and so when healthcare providers were having a hard time helping her with personal cares and helping her with her healing in the sense of occupational therapy, it occurred to me, I don't know if these people are tapping into her most essential nature, her creative nature, which is keeping her from wanting to engage and do the things that they were asking her to do.
Now, you also, you deal with those that are caring for people with dementia. I can understand using art, literature, even dance to, for lack of a better term, to get through to the person who's got dementia or maybe even Alzheimer's and unlock some of those passions that could help them improve their quality of living. But what about the daughter who's taking care of mom, who's not necessarily interested in art per se? Can you give her hands-on instruction in how to use these techniques, or is there training as an art teacher or a dance teacher or anything like that that's involved?
Yeah, that's a great question. I've had a lot of success with people who don't have a lot of confidence with art per se, in the sense where I help them realize that art, there's a quote I use often by Albert Hubbard, art is not a thing, it is a way. And so I help people discover that they do understand creativity through asking them usually a series of questions is the easiest thing, or essentially getting to know them. When I talk to people, I'll ask them if they have a certain recipe that they do it exactly right every time, but it's not followed, it's not written down. Or if they look at a certain image and feel something from that image. A lot of times looking at the same visual image, and perhaps it could be an art image or it could be a photograph of a landscape. Through looking at the same thing, people can relate and learn things that aren't related to the image, but they're related to the conversation the image provokes. So essentially, if I have somebody who's deliberately interested in art, it makes my job, I guess I wouldn't call it easier, but it's okay, what kind of art, and we go from there. If it's somebody who says, I'm not into art, I don't know how to dance, I don't know how to paint, then it would be more so tapping into what it is they know and finding a way to relate it to the art form and to make them feel comfortable using it.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio with Mindy Bolton, creativity coach and dementia care practitioner, discussing how creative thinking, using visual arts, literature, music, dance, and even improvisational theater techniques to enhance the quality of life of those suffering with dementia and Alzheimer's. And we've also been talking about not only unlocking some of the hidden potential in the minds of those suffering with dementia in order to improve their quality of life, but also coaching those who are giving care to dementia and Alzheimer's patients in how to successfully unlock some of their passions or maybe learn a new skill in order to improve the quality of life for their patients. It's been great having you here with us today, Mindy.
Thank you so much. I've really enjoyed it as well.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to our podcast on iTunes.